Yes, my favourite colour is red. That was an easy question. It's a football affiliation, so yeah. Okay, so good morning, everybody, and thank you for that introduction. And thank you for being here today. As you've heard, my name is Tony Holohan, and as many of you know, I spent most of my public health career working in government in Ireland, including 14 years as Chief Medical Officer. And it is from this experience that I speak to you today, not just as a professional, but as someone who's deeply committed to the idea that the true purpose of our systems, whether they're economic systems, social systems, or health, is to serve our well-being as people. And my experience of the pandemic brought me to a turning point in my own personal career, having spent more than 20 years working at the levels that I did in public health care. I felt compelled to go upstream for a second time in my career, just as I did when I moved from primary care to follow a path in public health almost 30 years ago. And I want to find ways of spending more time than I could in my former role in thinking about health and well-being in a wider context of ongoing global events, including the climate emergency, energy and water distribution, biodiversity loss, conflict, migration, and so on. And that's why I'm excited by the challenge as having been appointed as the director of the new Centre for One Health established in February of this year in the College of Health and Agricultural Sciences in UCD. We see how precarious and unsustainable modern living has become. And we see the urgent need to find innovative and sustainable responses for the future of mankind, fragile ecosystems, and the planet upon which we all depend. And in a way, I wonder why we don't talk about this enough. And therefore, I want to commend you as organisers and you all as participants for creating a space for some of these important conversations. So somebody has already stolen my line. Please close your eyes, if you don't mind, for another moment. Not for a moment of meditation, but just to picture a world in which our children breathe clean air, where everyone, regardless of their background or circumstances, has access to the care they need to thrive. Imagine a society that measures its success not by the rise and fall of stock markets, but by the health and happiness of its people. A world where we don't chase after endless economic growth, but instead cultivate the well-being of our communities and the resilience of our planet. Now open your eyes and reflect on the reality that we live in today. We're faced with headlines that celebrate GDP growth, while health systems around the world crumble under pressure, inequalities widen, and our planet edges closer to ecological collapse. We prioritize short-term profits over long-term survival, and in so doing, we neglect the very essence of what it means to be truly prosperous. We're trapped in a system that tells us that economic gain for a few is worth more than the well-being of the many. But this isn't just a crisis of policy. It's a crisis of imagination. We've become so accustomed to this narrow view of progress that we've forgotten what it means to truly thrive. And this is why we all came together here today to challenge that narrative, to reimagine our futures, and to demand that our systems, whether they're economic, social, or health, serve the people and the planet, and not the other way around. And I want to be clear that my comments and criticisms are not directed at any specific country, including Ireland. They're global in nature. And the challenges that I described are universal. They affect countries and communities worldwide. And it is crucial that we focus on these issues collectively, without the distraction of attributing blame to individual governments or policies. So as I've said, we live in a world where success is often and too often measured by one narrow metric, which is GDP or gross domestic product. But this does not capture the true well-being of our societies. It fails to take account of the health of our communities, the quality of our environment, the fairness of our social systems, and the well-being of individuals and families. GDP growth can occur even as inequalities deepen, health outcomes worsen, and environmental degradation accelerates. This focus on GDP-driven growth has led to policies that benefit the few while neglecting the needs of the many. And it has resulted in a world where economic gains are concentrated in the hands of a small elite, while the majority of people around the world struggle with stagnant wages, precarious employment, and diminishing public services. It is a system that prioritizes short-term profit over long-term well-being, contributing to the destruction of our planet and the well-being of all of us as people. As I've said, the purpose of our economy should be to serve the well-being of people, not the other way around. We need to shift our focus towards holistic indicators of progress that reflect true societal well-being. Measures like health outcomes, educational attainment, environmental sustainability, and social equity. And this, I believe, is not just a moral imperative, it is essential for building resilient societies that can withstand and recover from crises. Over the past several decades, we have seen a proliferation of international frameworks and agreements aimed at promoting health, sustainability, and equity. Many of these will be familiar to you, from the Ottawa Charter for Health Promotion in 1986 to the Declaration of Alma-Ata in 1978 on primary health care, from the Rio and Paris agreements on the climate emergency to the United Nations Sustainable Development Goals. These frameworks have laid out ambitious visions for a healthier, more equitable, and more sustainable world. As you know, we're now approaching COP29, another crucial moment to reaffirm our commitments to combat the climate emergency and to promote planetary health. The recently formed quadripartite alliance between the World Health Organization, the Food and Agriculture Organization, the World Organization for Animal Health, and the United Nations Environmental Programme aims to integrate a One Health approach to address these challenges. But even this effort faces significant barriers. Despite these numerous commitments, we are not making progress. In fact, by many measures, we're moving backwards. We're falling behind on critical goals such as reducing inequality, combating the climate emergency, and ensuring overall good health and well-being. This implementation gap often arises at the country level, where global commitments are not translated into effective national policies and actions. Governments may sign up to international agreements, but sometimes lack the political will necessary to implement the changes. Competing priorities, vested interests, or the fear of particularly right-wing backlash often results in inaction. Many countries, especially low and middle-income nations, lack the financial and technical resources perhaps needed to implement global commitments effectively. One Health is an example of how global frameworks require cross-sectoral collaboration, yet most governments are organised into vertical silos, leading to a lack of coordination across sectors and policies that are at times inconsistent and perhaps even at times contradictory. So whether it's the fossil fuel industry undermining climate action or the pharmaceutical companies prioritising profits over access to medicines, powerful actors work against our collective public interest. International agreements often lack robust accountability mechanisms. Without clear consequences for non-compliance, countries can and often do ignore their commitments without fear of reprisal. If we are to close this implementation gap, we need a new approach to global governance, one that emphasises agency, literacy, accountability, transparency, and genuine partnership. We need to empower citizens to hold their governments to account. We need to strengthen international institutions to enforce these commitments. And above all, we need to prioritise the health and well-being of people and the planet over short-term economic and political gains. The recent COVID-19 pandemic was not just a health crisis, it was a crisis of inequality. The virus itself may have been indiscriminate, but its impact was not. It spread more easily in overcrowded housing, took a heavier toll on those with pre-existing health conditions, and exposed the fragility of healthcare systems that were underfunded and overstretched. As Chief Medical Officer, I saw how deeply these inequalities shaped the outcomes of the pandemic. The burden of disease and death was borne disproportionately by those who were already disadvantaged, those in low-income jobs, those without access to healthcare, those living, for example, in cramped and unsafe conditions. The pandemic exploited these vulnerabilities, and it did so with devastating efficiency. It showed us that our world is fragile and that our systems are not as resilient as we might like to believe. It has also shown us, however, the power of collective action, the importance of community, and the value of solidarity. And I believe we cannot afford to ignore these lessons. We need to build on them and to create a future in which health and well-being are the foundations of our societies, and where the economy serves the needs of all of its people, and where we live in harmony with our planet. If we are to build resilient health systems, we must tackle the root causes of health inequalities. And this means tackling the social determinants of health: poverty, housing, education and employment, and so on. It means ensuring that health systems are truly accessible to all, regardless of income and location. And it means recognizing that health is not just the absence of disease, but the presence of conditions that allow for individuals and communities to thrive. We must also recognize the role of structural racism and discrimination in shaping health outcomes. Again, the pandemic showed us that race and ethnicity are significant predictors of health outcomes, not necessarily always because of inherent vulnerabilities, but because of systemic inequalities in access to resources, opportunities, and care. Addressing these inequalities is not just a matter of justice, it is also a matter of public health. Despite the lessons of COVID-19, we've yet to see the global leadership to prepare for the next pandemic. The failure thus far to agree on a new pandemic treaty is a glaring example of short-sightedness and political inertia. We're in danger of repeating the same mistakes, failing to invest in preparedness, failing to coordinate our responses, and failing to ensure that everyone, everywhere, has access to the tools they need to stay safe. The reasons for this failure are clear. Powerful interests that prioritize profit over public health have resisted efforts to create binding international agreements. National governments, sometimes wary of ceding sovereignty, have balked at committing to global health measures. And geopolitical rivalries have stymied efforts to build a coordinated, coherent response. We cannot afford to wait. A new pandemic treaty, still under discussion with the WHO, is essential for ensuring that we're better prepared to detect, respond, and prevent future global health emergencies, such as the pandemic. It must include mechanisms for equitable access to vaccines and treatments and other countermeasures, robust surveillance systems, and clear protocols for international cooperation. It must address the structural inequalities that make some communities more vulnerable than others. And it must be underpinned by a commitment to global solidarity and shared responsibility. The pandemic showed us that global health security is only as strong as its weakest link. A virus does not respect borders, we know that, and therefore neither should our response. We therefore need our international treaties to reflect this reality, a treaty that puts the health and well-being of all people above the interests of the few. One Health is a framework that recognizes the interconnectedness of human, animal, plant, and environmental health. But too often our approach has been vertical, narrow, and fragmented, focusing only on zoonotic illness and antimicrobial resistance, while neglecting other critical components that shape our health, such as the health of the environment and plant health. Plants are the foundation of our ecosystems and our food systems. They provide the oxygen we breathe, the food we eat, and the raw materials for countless products. Yet their health is threatened by the climate emergency, pollution, invasive species, and unsustainable agricultural practices. When plant health is compromised, it has cascading effects on human health, food security, and environmental sustainability. We must therefore broaden our understanding of One Health to include plant health as a core component. This means investing in sustainable agricultural practices, protecting biodiversity, and promoting ecosystem resilience. It means that recognizing that healthy plants are essential for healthy people and healthy animals. And it means developing policies that integrate plant health into our broader efforts to build resilient health and health systems. For example, consider the impact of plant diseases on food security. When crops fail, food prices rise, hunger spreads, and communities are destabilized. And this in turn can contribute to conflict, displacement, and further crises. So by protecting plant health, we can contribute to the prevention of these ripple effects and build more resilient communities. The newly established Centre for One Health at UCD represents a transformative step towards realizing a comprehensive One Health vision. As its director, I'm committed to expanding the scope of One Health beyond its traditional boundaries, integrating insights from diverse fields such as economics, social sciences, law, and the humanities. Our goal is to create a truly interdisciplinary framework that addresses the complex global challenges that we face, from the climate emergency and biodiversity loss to food security and health inequalities. The centre is poised to become the first WHO collaborating centre on One Health in the world, a designation that underscores our role as a potential leader in this field. We're actively engaging with the quadripartite I mentioned earlier on, the World Health Organization, the Food and Agriculture Organization, the World Organization for Animal Health, and the United Nations Environmental Programme to influence global policy and practice at the highest levels. But we cannot do this alone. We need your support, your expertise, and your partnership. So I invite everyone here today to join us in this journey. You can visit our website at www.ucd.ie/onehealth/join. Become a member and be a part of this collaborative effort to shape the future of global health. And I want to hear from you personally, your ideas, your experiences, your vision for what One Health can achieve, what it can contribute to global health. And I look at the agenda of the meeting that you have today and the wide range of your collective experience and expertise, the strength of your commitment and the intensity of your passion. And if there's anything that interests or engages you in what I've had to say, I'd be happy for you to reach out to me again at tony.holohan@ucd.ie. Please feel free, I'd very much welcome it. I've often advocated for the need to shift our focus upstream to address the economic, social, environmental and commercial determinants of health, rather than merely responding to the downstream effects of illness. As I've said, the COVID-19 pandemic was a stark illustration of this need. Yes, it's true to say that SARS-CoV-2 was the viral cause of COVID-19, but the underlying factors, inequalities in socioeconomic status, economic conditions, housing, access to healthcare, etc., were what determined the vast burden of mortality and morbidity. These systemic weaknesses make societies more vulnerable not only to health crises, but also to environmental and economic shocks. Addressing these challenges requires a systems approach that recognises the interconnected nature of these global issues. And this means integrating health into all of our practices, promoting sustainable practices, and ensuring that the health and well-being of people and the planet are central to our decision-making processes. I believe we're at a critical juncture. The choices we make today will shape the future of our societies and of our planet. We have the knowledge, the tools and the resources to build a healthier, fairer and more sustainable world. What we need now is the will to act. And so I call on all of us, whether we're policymakers, healthcare professionals, community leaders, citizens, to advocate for a new vision of health and well-being that prioritises equity and sustainability. And I call on our leaders to show the courage and vision needed to support a new pandemic treaty that protects all people, not just the wealthy and the powerful. I call on us to address the implementation gap in respect of international commitments and ensure that the promises made in fora that I've just mentioned, like the UN and the WHO, are realised on the ground. And I call for each of us to commit to a One Health approach that recognises the interconnectedness of our world and works to protect the health of people, of animals, of plants and of the environment. I don't think we can be satisfied with incremental change. We need to demand transformative change, change that can serve the many and not just the few. Change that can contribute to protecting our planet and ensuring the health of future generations, and change that places health and well-being at the heart of everything we do. And let us ensure that the commitments made in these international fora, as I've said, are not just words on paper, but real actions that transform lives. So in closing, I want to express my deep gratitude for the invitation and for the opportunity to speak to you today. The challenges we face are immense, but so too, I believe, are the opportunities. And by working together, by embracing a holistic vision of health and well-being, and by refusing to accept the status quo, we can create a world where everyone has a chance to lead a healthy and fulfilling life. Thank you.